My name is Victoria Mormon, and I am presenting on alcohol-related liver disease. For the clinical case, Barry, a 52-year-old male, presents with jaundice, upper right abdominal pain, and a slight fever. He complains of constant fatigue, nausea, and a loss of appetite that has resulted in a significant loss of weight in the last 2 months. Barry's wife tells the nurse that Barry has been drinking every day for the last 30 years and will often drink 15 or more alcoholic drinks per week. The etiology of alcohol-related liver disease, also called ARLD for short. The main cause of ARLD is alcohol, hence the name. This can result from either binge drinking or just the general overconsumption of alcohol over a long period of time. This occurs due to the breakdown of the liver when the hepatocyte apoptosis takes place, along with the invasion of neutrophils and macrophages in the liver. There are 4 subcategories of ARLD, beginning with simple hepatic steatosis, which is also called fatty liver disease. This is reversible. Alcoholic hepatitis, fibrosis, and cirrhosis are not reversible. Here are the 4 subcategories again, ranging from inflammatory problems to scarring, which is that fibrosis, and cirrhosis is overall failure of the liver. Starting with alcoholic fatty liver, the steatosis generally presents without any symptoms and is a retention of fat within the liver. This stage is reversible. The inflammation of the liver occurs during alcoholic hepatitis, which is the second stage shown. This typically presents with jaundice and can be improved but not reversed. The third step in fibrosis is the abnormal formation of scar tissue around the liver. This is caused by the invasion and activation of macrophages. The fourth step of fibrosis is the final stage of ARLD and presents with jaundice, which also presents with easy bleeding or bruising, weight loss, fatigue, and nausea. Some background/facts of ARLD. 20% of ARLD patients will develop cirrhosis. This typically occurs after 10 years of developing the disease. 20% of all liver transplants are due to ARLD. 35% of ARLD patients develop alcoholic hepatitis, which is that second stage, which is the beginning of the irreversible part of the disease. And about 37,000 deaths per year are caused by alcohol-related liver disease, and this is at any point during the 4 subcategories or 4 stages. Just an overview of what binge drinking is, which is one of the main causes of ARLD. Binge drinking alcohol levels are considered a BAC, or blood alcohol concentration, at or above 0.08 grams per deciliters. In men, this presents as 5 or more drinks in 2 hours or over 15 drinks per week. And for women, that is 4 or more drinks in 2 hours and over 8 drinks per week. Some of the risk factors. The main risk factor, again, is binge drinking and heavy drinking. This is also closely related to individuals with alcohol abuse and dependence problems. This also ties into genetic factors, which can either be these dependence and abuse problems or the decreased ability to process alcohol within the system. Other risk factors include having hep C or being overweight or obese. In a nutshell, the pathophys is long-term alcohol consumption, which is that heavy drinking or binge drinking, which leads to chronic inflammation of the liver and the hepatocyte apoptosis, which is hepatocyte damage within the liver, and then the fibrosis and scarring of the liver, ultimately leading to cirrhosis. Pathophys continued. Overall, the causes of ARLD are not fully understood, but here's what we know. There are 3 things that are related to ARLD. Those 3 things are the environment, genetics, and behavioral patterns. One thing we definitely know is that it is due to the overexposure of alcohol. Consistently, that does cause inflammation, the steatosis, which is the reversible part, and then the fibrosis leading to cirrhosis. That fibrosis, again, is the scarring of the liver. Also, enzymes that are used to metabolize alcohol within the system cannot be upregulated. So, that upregulation means that it cannot handle um, the large amounts of alcohol that come with binge drinking. So, that does cause oxidative damage to the liver. So, the liver is not able to degrade large amounts of alcohol or that ethanol. Here's a chart showing that. So, increased alcohol intake will cause oxidation, which leads to the production of an acetate. Other factors, again, are genetics, hep C, and then that inflammation, fibrosis leading to cirrhosis, so just further damage of the liver. ARLD is caused by inflammation in the liver due to alcohol overconsumption, and again, that binge drinking. Some symptoms of ARLD typically begins with asymptomatic stuff. If anything, it'll be weight loss or nausea. But the first stage, which is that fatty liver, the fat buildup within the liver, is asymptomatic. The progression does include jaundice pretty quickly with the hepatitis to fibrosis to the cirrhosis. Those will all present with jaundice. Fatigue, weakness, sometimes a low-grade fever is present, and then typically that abdominal pain or tenderness in the upper right quadrant, as seen in that clinical case study. For diagnosis, there are 2 serum tests that can be done. The first serum test is the serum bilirubin test. This determines if the liver is excreting bilirubin, which is an enzyme released by the liver. If those levels are low, it will lead to symptoms of fatigue, vomiting, nausea, dark urine, and that upper right quadrant abdominal pain. The second serum test that can be done, this measures albumin in the blood. This is a protein found in the blood. Low levels of albumin lead to jaundice, weakness, and increased protein in the urine. Also, diagnosis tests that can be done are a liver biopsy, which is shown in the bottom right corner of this slide, and a sonography, which is to assess the blood flow through the liver. Decreased blood flow also can show scarring and fibrosis in the liver. Treatments, unfortunately, there are not many treatments that can be done besides complete transplant or stopping all intake of alcohol if you're in the first few stages of the subcategories of ARLD. So stopping drinking altogether or safe drinking levels can be practiced. These safe drinking levels are 1 drink per day for women or 2 drinks per day for men. That cirrhosis will lead to a place on the transplant register. So extreme ARLD is that scarring and cirrhosis. Here are my references. Any questions? Thank you for listening.